What can functional imaging reveal in cystic fibrosis? Imagine having a way to see inside the lungs that goes beyond just looking at the structure. Functional imaging in cystic fibrosis provides detailed insights into how well different parts of the lungs are working. Unlike traditional lung tests that give an overall picture, these imaging techniques can show exactly where airflow or blood flow might be impaired. This helps doctors understand which regions are most affected by the disease, revealing the heterogeneity within the lungs. It's like having a map that highlights the trouble spots, making it easier to target treatments. Functional imaging can detect areas where ventilation or airflow is reduced and where blood flow or perfusion is compromised. Techniques such as specialized magnetic resonance imaging, or MRI, can identify these abnormalities without needing contrast agents. These areas of ventilation or perfusion defects often match clinical measures like the lung clearance index, which is a sensitive way to assess lung health even in early or mild cases of cystic fibrosis. This means doctors can catch changes sooner and monitor disease progression more precisely. Combining structural images, like high-resolution CORT scans, with functional imaging gives a fuller picture of lung health. Structural images show damage like bronchiectasis or mucus plugging, while functional images reveal how these structural changes affect airflow and blood flow. This integrated approach helps track how the disease evolves and how well treatments are working over time. It's especially helpful for adjusting therapies to better suit each patient's unique lung condition. One of the biggest advantages of modern MRI techniques is that they do not expose patients to ionizing radiation. This makes them ideal for repeated use, which is important because people with cystic fibrosis often need lifelong monitoring. Some advanced MRI methods use hyperpolarized gases or avoid contrast agents altogether, providing dynamic views of lung function without the risks associated with radiation or contrast. This safer approach allows for more frequent assessments, helping to catch exacerbations early and evaluate how well treatments like antibiotics or new drugs are improving lung function. Functional imaging is also sensitive to changes caused by treatments. For example, if a patient starts a new therapy or experiences a worsening of symptoms, these imaging techniques can detect subtle shifts in ventilation or perfusion. This helps doctors see if a treatment is effective or if adjustments are needed. It's a powerful tool for personalized care, giving real-time feedback on how the lungs respond to different interventions. While high-resolution CORT remains the gold standard for detailed structural images, functional MRI is rapidly advancing. Researchers are working to improve the resolution and develop standardized ways to score ventilation and perfusion abnormalities. Although there are some limitations, such as lower spatial resolution compared to CORT, ongoing innovations are making functional MRI an increasingly valuable part of cystic fibrosis management. In summary, functional imaging reveals detailed, region-specific information about how well the lungs are ventilating and perfusing blood. It complements structural imaging, offers a radiation-free way to monitor lung health over time, and helps tailor treatments to each person's needs. By providing a clearer picture of lung function beyond what traditional tests can offer, it enhances our understanding of cystic fibrosis and supports better, more personalized care. Always remember to consult healthcare professionals for individual advice and treatment options.